Good evening, good afternoon, and good morning. This is the 1647th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. T.AJAYAN, Professor. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and homeopathic doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. We have the international session in English from 8:30 to 9:30 and a local language session in in Malayalam from 9:30 to 10:30. We are uploading the videos of the same on the very next day itself so that those who missed the session can watch it again. You can subscribe the same with your friends so that you can take homeopathy to every home around the world. The purpose of this forum is to promote homeopathy and to make aware about homeopathy among public. We are already more than 3,500 videos have been uploaded in the YouTube. Those who missed the session can watch it from the previous videos also. If you just click on the IFPH Homeopathy at YouTube. Let me come to the introduction of today's guest. As you all know, today our guest is Professor T.AJAYAN. Please. There was a difficulty for our guest to join. That's why sir was calling me. And as you all know, Professor T.AJAYAN is one of the leading doctors in Kerala who has made national as well as international presentations in different part of the world. And he has taken so many sessions in this forum also. And he has done his BHMS and then completed MD and now working as the professor as well as the head of the department of practice of medicine, Sri Sarada Krishna Homeopathic Medical College, Kulasekharam, Kanyakumari. And we all know that this college is a wonderful college which giving a lot of practical experience to doctors who are coming out from this college. This college is having BHMS, then a postgraduate degree, and now they have even research centers also there. Dr. Ajayan is leading from the front and in teaching all the practical knowledge to students, so that those who come out from this college are very well equipped in practicing homeopathy. Our guest has joined now, and we are very happy to welcome Professor Dr. T.AJAYAN to this session. I have introduced you in this forum, sir. Please, you can unmute, sir. You can unmute, sir. We proudly welcome you. You are the co-host now, sir.
Okay, is it clear, sir? Is it audible? Audible?
Yes, audible.
Is it audible, sir?
Yes, sir. You are audible, and we can see you.
Sir, I share my PowerPoint.
Okay. Yes. Today, sir, we'll be discussing about the management of summer compliance with homeopathy.
Okay, sir. Is my PowerPoint is clear, sir?
Yes,
the
yes,
PowerPoint
clear. Typhoid fever. Yes, and now typhoid. Yes, respiratory disorders. prevention. I like that. Or beat the heat. Yes. Yes. Fine, fine.
Okay, sir. Just a minute. Just a minute. Good afternoon. Good evening to all. Very sorry. It is my pleasure to you all present seminar, a topic on homeopathy management of the summer disease. As we step into a warmer month, we are met with a rise in seasonal ailments like heat exhaustion, dehydration, sunstroke, then prickly heat, certain allergies, and gastrointestinal disturbance. While these conditions are common, in their effective and the holistic management remains a crucial aspect of the healthcare. In our system, homeopathy, with its individualized approach and minimal side effects, offers a gentle yet effective way to address these summer related disease or summer related health concerns. Through this seminar, we are explore how homeopathic remedies can help to prevent and manage the summer disease, to enhance overall well-being and restore the body's natural balance. Then, therefore, our topic is beat the heat. There's a homeopathy management for the summer complaints. The summer normally increase the risk of heat-related illness. Everybody know dehydration, vector-borne infection, and foodborne diseases. The preventive measures such as hydration, proper hygiene, sun protection, and timely medical intervention help to mitigate the risks. The public awareness and proactive healthcare strategies are essential to control the seasonal disease outbreak and ensure well-being. Normally the most of the seminar we are discussing the winter, that is rainy season diseases, but it's very rarely we are discussing the summer-borne diseases. Then the summer or in this particular season, the diseases, the complaints are classified into the heat-related or gastrointestinal, then vector-borne diseases, then waterborne diseases, respiratory, and as well as the few conditions like malaria, like skin manifestations. Then out of these, then all other gastrointestinal, vector-borne disease or waterborne disease, respiratory, is not only in this particular season is prevalent. Therefore, in our day-to-day practice, these group of these related diseases are prevalent. Either gastrointestinal, respiratory, vector-borne, and waterborne diseases. But the main important areas we have to discuss, the need of the discussion is the heat-related condition, the main. The summer complaints is related to, we are already discussed, in heat-related to diseases, the conditions are heat stroke, heat syncope, and anhydrotic heat exhaustion. These are the common three conditions under heat-related. In gastrointestinal diseases, the main one is the food poisoning, diarrhea, and cholera. The vector-borne diseases is like other seasons is prevalent, like dengue, malaria, and chikungunya. The skin manifestation also is prevalent in warm, humid this climate. Is like fungal infection, then sunburn, the malaria, and the skin condition is otherwise prickly heat. Prickly heat. Then respiratory diseases like flu, the common cold, conjunctivitis. Then waterborne diseases like the type-borne diseases related to typhoid, then hepatitis A and cirrhosis. Then first one is the heat-related illness. The heat-related illness includes the three conditions we are already convey with you. The first one is the heat stroke. Then heat stroke, we are commonly use the drugs, you know, then clonine, then cardies. We are discussed later. Then homeopathy part we are discussed later. The heat stroke is defined as clinically as a core body temperature that rise above 40 degrees centigrade. The accompanied by the hot, dry skin, and the central nervous system abnormalities such as delirium, convulsions, and coma. Then just you remember what are the clinical symptoms is related to this condition. The acute neurological features such as it's a restlessness, delirium, agitation, convulsion, and coma. The headache, the irrational behaviors include the hyperpyrexia, the neuropsychiatric disturbance, and a hot and dry skin, the tachycardia, tachypnea. There is 20% of patients have hypotension. The majority in clinical and pathogenesis, we are talking what is the reason for this complaint. That is an exercise or the heat stress can causes increased metabolic activity or the metabolic rate is increased. The increase the metabolic rate, it can causes the core body temperature is rise. It can causes the sweat. Then increase the core body temperature, it can respond for the increased cardiac output. The increased cardiac output is there is a decrease the visceral blood flow and increase the skin blood flow. Is promoting the increase the skin blood flow. But increasing the skin blood flow can causing the decrease of then blood reach in the internal vital organs. It can causes the decreased central venous pressure. Is responsible for the body temperature is increases. It can cause the cell anoxia. In cell anoxia in the different structures in our body, it can cause us the cellular injury. That is the inflammatory response. This inflammatory response, the inflammatory response of the system, it can cause us, we are collectively, we are call it as heat stroke. During the heat stroke, then associated with, if the central nervous system associated with the liver dysfunction can cause acute renal failure. These are the pathogenesis. Then you are just you are describing the detailed manner. Why I say this pathogenesis? The reason is in different stages of the heat stroke, then our medicine is changes. That means then increase the metabolic rates. Then suppose increase the core body temperature. That time a group of itself for the management of the second or third stage of the disease. Therefore, the homeopaths always need. Then here, then just we are discussing the parameters, then stage of disease. The stage of disease, the early stage, that is a heat exhaustion stage. The vital signs, the parameters assessed then in clinical practice, first you are assess all the vital signs. Then vital signs, you are just help for. Then heat rate increase, the BP is decrease, the body temperature, then you are just your workout, the body temperature, and you are checking the parameters in early stage. Simultaneously, we are checking electrolyte, that is the amount of sodium, potassium, and the last is an urine analysis. The urine always is a dark concentrated urine. Then in early stage, very just low in the sodium and potassium. This knowledge is very essential to help for the right general management. That time, if you have our diagnosis is in early stage, the immediate attention and the general management side we are concentrating, the immediate cooling the measures, then hydrate the patient, then just related to the sodium and potassium, just your advice, correct the electrolyte or correct the electrolyte balance and observe the patient. The sometime the patient is in critical stage. Is critical stage your assessment, the parameters to be assessed, then write the CBC, the complete blood count, LFT, then again, like our early stage, check the sodium and potassium and renal function test. Is very essential. There, critical stage, definitely the temperature is exceeding more than 40 degrees centigrade. There is glucose, then CBC shows the leukocytosis and elevated transaminase level, the liver stress, and low elevated the creatine level. Elevated creatine level. That time, then critical stage, the emergency support is very essential. Therefore, in addition to the management in the early stage, in addition, there group of peoples that definitely need IV infusion. There, then IV infusion, the normal saline is the best one. There is a monitor and urine output also we are monitoring. But in another stage or is an advanced stage, that is a very critical, then some you need the management only in emergency rooms or in the ICU setup only we are manage the situation. That is we are assess the arterial blood gas and creatine phosphokinase, the myoglobulin. The both everybody know. There is indication of the skeletal muscle injury. The not only the creatine phosphokinase and myoglobulin is increased in the cardiac skeletal muscle injury, because we are know these both are the biomarker for the ischemic heart disease. But all the skeletal muscle related injuries there, the creatine phosphokinase is increased. The myoglobulin is the first enzyme increase in the blood. But the majority of cases it is not considered as a marker because within 24 hours is excreted through the urine. Therefore, the majority of the clinicians is not considered as a biomarker. Then in advanced stage, must we are monitor ECG and CT and MRI. Then here just in interpretation is, and suppose this advanced stage, the metabolic chance for metabolic acidosis or the chance for developing the different rhythm changes, that is called it as arrhythmia. Then also the chance for developing the cerebral edema. In that group of cases, in general management side, just your electrolyte support, acid-base correction, then again aggressive cooling is needed. The coagulation support is you are give and provide neuroprotective strategies are need for the management of advanced stage of the heat stroke cases. Then in preventive level, the hydration, drink water, avoid caffeine, and sugary drinks. The clothing and protection, loose, lightweight clothing, stay in shade for a peak hours, avoid direct sun exposure during that time period done even to 4 p.m. Then athletes and outdoor workers that take frequent breaks in shades, that consume extra amount of salt, that is average, then 12 to 15 gram per day, shows the T wave changes. The T wave changes mainly there. ECG shows flattened T wave. The neutrophilic leukocytosis, maybe thrombocytopenia, that is the platelet count is decreased, elevation of blood urea, bilirubin, uric acid, and the reduction of the plasma bicarbonate, potassium, sodium, calcium, and phosphorus. The management, the first point we are noted in our management, in our aim to reduction of the rectal temperature below 39 degrees centigrade within 1 hour, and restoration of the circulating blood volume and support of various organ system function. That is the first line of treatment. And rapid cooling to the rectal temperature below 39 to 38 to 39 degrees centigrade may precipitate convulsion, vomiting, and hypotension. In that group of people, that type of management, related management, also very essential. Then important medicine, the immediate cooling measures in this time we are discussing this in our home care management. That is, we are almost they are practitioners in our treated the cases in dispensary. Therefore, the laymen and ask about during the time of this time seasons, what type of the what are the care we are need in our home. Therefore, the doctors are able to advise all these things. The immediate cooling the measures, move it to cool areas, remove excess clothing, the loosen or remove unnecessary clothing to help with the heat dissipation. Then apply cold compresses, the place ice packs, cold, wet cloth on armpit, groins, neck and forehead, cool water immersion. Then fan and mist method, that is use a fan while misting the person with water to enhance cooling. Then in home care management, then just you are concentrated for the hydration, the use of the tender coconut water or lemon water. Your advice, the natural hydrating drinks can help to restore the lost electrolyte. The best option is the tender coconut water. This one you should advise. In hypotension, never advise the directly, never advise the salt, but common salt, the just the coconut water and lemon water is a little helpful to promote the increase the potassium. Then the patient is covered with a wet sheet or the towel and sprayed with the cold water while air blown or fanned over him to promote the evaporate cooling. These are under general management. The patient should preferably, why we are the more concentrating the general management and home care, because then even this knowledge, this general management and home care knowledge is insufficient for to manage the situation. Then second on in general management, the patient should preferably be in a lateral recumbent position or hand and knee position to expose as much of the skin as possible the air. Therefore, the best method of to advise the patient on lying on the floor. The one is the recumbent position, that is a left lateral or right lateral recumbent position, or the hand and knees position to expose as much of the skin as possible to the air, exposed to the air. As an alternative, the patient may be immersed in cold water. That is, ice water is not preferred. That is very, very important. Ice water never advised. Ice water is not preferred because of the possibility of shivering and hypotension. The lips are gently massaged to promote circulation in this general management side. But these are the few homeopathic medicines I will discuss with you for the heat stroke. In beginning, I say the important drug include clonine, then camphor, and the natron carbonica. Then few rubrics from the different repertories: head, sunstroke, aconite, and belladonna. The head pain, sun exposure, then glonine. Then head sunstroke, the amyl nitrosum, natron carb, and glonine. These are the drugs. Then sunstroke, the nausea and vomiting. This is from the repertory. Uh, then four drugs to be your considered ars, bryonia, glonine, and terbium. Then sunstroke, headache, acute, belladonna and glonine. Sunstroke, headache, and chronic, aconite and belladonna. Sunstroke sequelae, there is a lachesis and natron carb. In addition to this, the three drugs you are to be remembered: the natron carbonicum, camphor, and glonine. The camphor, then everybody know the patient is on the collapse from the sunstroke. Then with the icy coldness of the body is a characteristic feature of the camphor, and sudden sinking of strength. Then another feature of the camphor. The natron carbonica is a great debility caused by heat of summer, headache from slight mental exertion in summer season. But glonine is an effect of the sunstroke, the heat in head, throbbing headache, then singing of heart, every pulsation felt in our head and body. These are the features of the glonine. Then another condition is the heat syncope. Heat syncope may be occur in hot environment in absence of demonstrable water and salt depletion. That is a heat syncope. But as you remember, not like our heat stroke, the heat syncope in occur hot environment in the absence of demonstrable water and salt depletion is less. Their mechanism of development of the disease, you remember, syncope, everybody know that is the perfusion of blood towards our head is decreased. Is a reason for the syncope. Then here the syncope result from the cutaneous vasodilatation. Why in heat season the causing the syncope? Syncope means the perfusion towards the head, towards the brain is decreased. Here what happened due to this heat, the cutaneous vasodilatation and result and systemic and cerebral hypotension. The cerebral hypotension that can cause the perfusion of the blood is decrease in the blood. The pooling of blood in blood vessels of the muscles and skin, especially of the lower limb during or after physical activity. The clinical features of that is a syncope. The immediate after the heat exposure on prolonged standing or the sudden change of position. Then features we are seen in clinical practice: vertigo, then nausea, then again giddiness, then blood pressure is low, the pulse is very slow. These are the manifestations we are seen in heat syncope. And then the stage wise, then investigation and the management we are thinking. Early stage, that is called it as a pre-syncope stage. Then syncope, then it's a transient for a transient period. There is another stage. There is a third stage is an advanced stage. In early stage, just you are checking like the heat stroke we are previously discussing. You are checking vital sign, electrolyte, glucose, urine analysis, all are essential. But in management side, early stage, the move the patient to a cool place, the shaded place, and lay down. And then just for a syncope patient, just to elevate the legs, lower extremities. Then elevation of the lower leg is an increased or promoting the flow towards the blood flow towards the head. Then in addition to this, in early stage, you are recommended oral dehydration with water electrolyte. At least you are a cup of water, you are just you add, then one pinch of, then a salt and a tablespoon of the sugar, you are mix it, you are just to advise it in early stage. The monitor, the vital for the further deterioration. But in transient syncope, transient means a time period only the patient in clinical side presenting loss of consciousness. That cases are like then our heat stroke, then the patient, the positioning, that is Trendelenburg, the position to maintain the patient for to maintain the transient syncope, that is an elevation for a time period. You are elevate the leg and ensure the airway patency. The patient is, you are ensure then patient is able to breathe out normal inspire or expire. You are concentrated. The quality we are concentrated. Then, if needed, then advise IV fluid. The normally then enter then BP and heart rate. In advanced stage, neurological assessment is very essential. But that time, the management said the continued oral hydration. Then not a particular period only, never given of hydration for IV infusion. The sometime the long time you need a continued oral hydration and as well as infusion. Then a gradual sitting and standing, avoid sudden posture change, etc. In home care management, just your advice that just your elevation of the leg, then they have the victim then advised to lie down, then apply cold compresses in axilla and forehead, then use of the fan to lower the temperature, then just to elevate the feet and have the victim to drink the sufficient amount of water and fluid. The fluid uh, the cool room, to maintain the patient on the cool room, the adequate fluid in the form of the simple beverage should be given. Then urine output maintain 1.5 liter per day. The bigger sense stands for the reduction of the urine output, but you are concentrating even the output is the around 1.5 liter per day is present or not. You check it. They take adequate amount of salt. Then average, that is we are doctors, therefore we are remember average 15 to 20 gram per day. Adequate amount of salt to be avoid reoccurrence. For a time period only you are recommended this additional amount of salt, that is 15 to 20 gram. Because and after a period again you should advise the salt, it can cause us hypertension. Then apply cool compresses like the previous we are discussing. Then homeopathic management for the heat syncope, one rubric is there: aconite, ars, bryonia, cadmium sulf, causticum. So many drugs are there. Then finding syncope. Then neuropathy recommended medicines: aconite, ars, populus, crotalus horridus, hepar sulf, ignatia, lacasis, moscus pulsatilla, and veratrum album. Then finding syncope in heat during nerve. One more drug is there, ignatia. Then a third condition is related to heat is an anhydrotic heat exhaustion. An anhydrotic heat exhaustion is a type of heat, whereas an affected person does not sweat adequately. That despite high temperature. The normally the temperature rise, the normally setting is there. Here is the patient does not sweat adequately. Is caused by the blockage of the sweat duct by swelling of the cells of the stratum corneum and the carotid plug formation. That is anhydrotic heat exhaustion. Then heat exhaustion or the heat stroke, there is slight difference is there. That just this table is helpful for you. The faint in heat exhaustion and heat stroke is a very serious condition, thrombing associated with the headache. Then here excessive sweating, but in heat stroke, no sweating. That means anhydrotic, then heat exhaustion or heat condition, then chance for the heat stroke. Therefore, we are carefully managing. Then in management, cool, pale, clammy, in clinical symptoms is cool, pale, and clammy skin. That is body temperature is shoot out, is exceeding more than 103 Fahrenheit. Maybe the present in gastrointestinal symptom, nausea and vomiting is there in both in heat exhaustion and heat stroke. But in heat exhaustion, rapid and weak pulse, but in heat stroke, rapid and strong pulse. The muscle cramp is there, even the electrolyte imbalance is indicated, the electrolyte imbalance. But maybe loss of the consciousness in heat stroke immediately call the ambulance. That is the immediate attention to be need for the management in heat stroke. They take immediate action to cool and the person until help arrives. Then heat exhaustion, we are already discussed what are the general management. Then clinical features then include then feeling of extreme warmth during the hot part of the body. Then again, the asthenia even at rest. Then impairment of working the capability. Then again, tachycardia, tachypnea, mild pyrexia. There is a skin manifestation during this time is a miliaria that is seen in the proximal part of the limb and on the trunk. Then the home care management, then shift the victim to a cooler place, then abstain from or candle better, then encourage the hydration, give cool water, that is oral rehydration solution, coconut water, electrolyte rich drinks, avoid alcohol and caffeine. Then like the management, generally heat management, loosen the clothing, the remove unnecessary clothing to help cool the body. Then apply the cool compressors, use fan and mist, lie down, elevate the leg. Or the same procedures for all type of the heat related conditions. The homeopathy management, then almost the same. Then you remember extraction of the heat, then very important one of the drug is an colchicum artemisinin. In colchicum artemisinin is a great weakness and sweating that doesn't provide relief. Then often after the prolonged exposure of high heat. Then next we are discussing then gastrointestinal disorders. In gastrointestinal disorder, the first one is the food poisoning. It's a common in the summer season, the food poisoning. It is an acute gastroenteritis caused by the ingestion of food or drink contaminated with either the living bacteria or their toxin or inorganic chemical substance and the poison delivered from the plant and animals. Then very simple. The food poisoning means the poisoning through food. It's very simple. But you remember the pathophysiology, that is contaminated food is handling and storage in warm and moisture climate, the multiplication of our microbes, the ingestion of these microbacteria or performed bacterial toxin, then associated with the followed with the clinical manifestations. Then in food poisoning, then is the time-wise their presentation and also the causation we are able to identify it. 1 to 6 hours in the period, the organisms Staphylococcus aureus or Bacillus cereus. Clinical side, nausea, vomiting, and diarrhea is a common food sources for the food poisoning. Then harm, that is like the pig meat, the poultry, potato or egg salad. Then is and widely nowadays the youngsters are used, the children are used mayonnaise. Then another source for the food poisoning is one of the carcinogen in product, food product. The cream pastries, etc. Then fried rice is as a common food sources. Then time average 8 to 10 hours. The most probably the Bacillus cereus or a Clostridium group. Yeah, this kind of infection, this type of microorganism followed by the food poisoning is there. Then in addition to this nausea, vomiting and diarrhea, the classical another presentation is abdominal cramp. There is a common sources like food sources. There is like beef, poultry, gravies, ligaments, meat, vegetables, dried beans, cereals, etc. The clinical manifestation include vomiting, diarrhea, headache, abdominal pain, nausea and vomiting is a common muscle pain, fever. These are the common clinical manifestation. Then stage-wise and interpretation is very needed in all the cases, because that time only we are able to advise the right investigation and we are able to advise right management. The stages of food poisoning. There is the first one is the incubation period, acute phase, severe phase, and the recovery phase is there. Then incubation period, that is a few hours of the days. Then through the just to the history wise, the patient the history diagnose the case. The shows we are take the food from outside, that is the source of the contamination. The just please we are wait for the monitor the symptom, and just to advise for the hydration, just to water and the related uh, uh, drinks only we are just advising. But in acute phases, the classical symptoms are developed: nausea, vomiting, diarrhea, abdominal pain is there. In that time, the definitely we are need investigation include must your check stool culture, blood test, including check the electrolytes, then complete blood count, urine analysis. It will help for this investigation is helpful identifying whether the bacteria or the microorganism is viral or other toxic causes. And then it will helpful to assess the dehydration. If you need then electrolyte supplementation is needed or not, the IV infusion is needed or not, is an help for you. In acute phase, therefore, then blood culture, stool culture, electrolyte, you are just you check it. Then in management side, the suppose the values are changed. If the sign of the dehydration is there, hydrate your patient orally. Then suppose the severe dehydration is there, the IV infusion, continuous IV therapy is needed. Then it also advise the probiotics. Then certain food is considered for probiotics. Then one of the drugs in homeopathy we are used for the probiotic. One of the two drug is there. One is the natrum phos and second one is silesia. Is that like the probiotics to promote uh, to promote the intestinal bacteria. Then severe phase, the persistent symptoms, high fever, dehydration, plus the neurological sign. The like our acute phase here also need the blood test, your stool, microscopy test. In addition to this, you must concentrate the kidney function test. It's also like the previous, these investigations is helpful to identify the organism. Then it is very severe bacterial or other viral or a toxic cause. Then also it will work out for the kidney function, especially kidney function test is helpful to work out renal failure is present or a chance for developing the complication or not. Then management side must need electrolyte correction and also IV therapy. IV continuous infusion is needed. In addition to this, medicinal management. The last stage is the recovery stage. Recovery phase is a gradual symptom resolution. Then you are, if check investigation side, the follow up the stool test if you are needed, and also if in severe, like suppose a patient under severe phase, the renal parameters are altered or liver parameters are altered. Again, you are check in recovery phase also. You are check it is come to normal or not. Then monitor, then organ function is affected. Then here, then the management said gradually patient is returned to normal. Then again adjusted the gradual diet you are recommended and avoid contaminated food sources. Then advise the probiotic with the homeopathic medicinal management. This is a protocol we are follow for the management of food poisoning. Then always I say there first we are stage wise we are diagnosis and stage wise we are advise the investigation. The stage wise only we are advise the management including general and as well as medical management. Then examination finding the vitals, the increased heart rate, the abdominal examination, the hyperactive bowel sound. The hyperactive bowel sound, they are checking is very simple. The first patient in clinical side presenting blotting of abdomen. Then how to check this a hyperactive bowel sound? Then while auscultation, then abdominal auscultation is an actually is a relatively a minor role. But in four area, then abdominal auscultation we are concentrating. The first one is two, it will help for whether the patient, their bowel movement is the normal or then hyperactive. How to check it? Then bell part of the steps, we are just to place over the abdomen and we are wait for 10 to 15 seconds. The 10 to 15 seconds, the normal peristaltic movement is average 3 to 4. 3 to 4, the peristaltic movement is considered is a normal within 10 to 15 seconds or 10 to 20 seconds. But is more than exceeding 5 is considered is a hyperactive bowel sound. Then again, in our day-to-day practice, then abdominal examination, abdominal auscultation is also helpful to work out. Is helpful for the surgeons. The surgeons are just returned to the normal peristaltic movement is indicated. Again, the patient is retained the normal gut function.
Excuse me,
Then
doctor.
one more.
Excuse me, 5 minutes remaining only.
Okay, sir. Okay, then gastrointestinal disease, and after that I wind up. Then remaining topic we are discussing in another class. Okay, sir.
Yes.
Yes. Then here there is abdominal. Sorry. The abdominal auscultation. Then another one is helpful to work out abdominal intestinal obstruction. The intestinal obstruction, just we are the time period is the same 10 to 15 seconds. You are wait there with the bell part is we are press over the abdomen and we are wait for we are heard the bowel movement. In intestinal obstruction, before the obstruction, we are the hyperactive, then abdominal movement. The movement is increase, but the hyperactive bowel sound. But the distal part of the obstruction, we are always silent. In this manner, we are able to differentiate where is the location of the obstruction. Not today is our topic, but the hyperactive bowel sound you are just to work out is an indication of the diarrhea. The neurological sign and skin and mucous membrane sign of dehydration, then like dry skin and sunken eyes. For the prevention, then proper food storage and refrigeration, washing the hand and kitchen utensils before handling the food, drinking cleaning and purified water, avoiding consumption of expired and spoiled food, and cooking food thoroughly. These are to be listen your workout for the prevention of the food poisoning. In management, adequate hydration, the severely dehydrated, just IV infusion such as the ringer lactate. It will contain sodium, potassium, and glucose. Then all these three, the micronutrients is there. Therefore, just to advise ringer lactate. Then also advise the probiotics is to restore the gut flora. Then the home care, that just to remember, rest the stomach. That means avoid the solid food. Advise ORS, coconut water, lemon water, plain water with the dilute fruit juice. Then fruit juice always the dilute and give it to the patient. Then eat light and easily digestible food. That is, you are always remember bread diet. Bread include banana, rice, apple sauce, and toast. You should advise. Then rest and recovery to avoid the strenuous activities and get adequate rest to be advised the patient. Then homeopathy management, arsenic album, pulsatilla, the China. These are the group of medicine. Out of this varietal album, these are copious, profuse vomiting, diarrhea, cold set, collapse, great weakness. These are classical symptoms. Then, like cholera, like symptoms, the try cholera remedy. One of the there is a rice, watery stool, abdominal cramping, nausea, etc. These are the group of medicines. The aloes overheating words from aloes, one of the best medicine. Overheating after in summer, that is brownish watery diarrhea, is a classical feature of bryonia. In summer diarrhea, the bryonia is one of the best medicine. Then today the time is over. The remaining the diarrhea and cholera is remaining in gastrointestinal disease, but remaining the few the system and systemic condition is there in related to the summer disease. That topic we are discussing in another class. Then once again, I extend my sincere thanks to the organizers and IFPH. Give me an opportunity to discuss the summer disease with you. Thank you.
Thank you, Professor Dr. Ajin, for an excellent session because South India, we have summer, particularly in Kerala, it is on the rise and a lot of acute cases are coming in and we need to prepare ourselves. And that's why such a session was prepared, was decided, and you have done a beautiful presentation. Since there is no more time, I invite Dr. Manoj to say also thanks to the session.
Thank you, Dr. Sanesh and Dr. Ajayan. The nice presentation, and it is in fact much needed on because the climate variation and temperature is rising each and every day. And so it is not only to give some instruction or general management, we are capable of giving some medicines. That is the most important thing as far as homeopathy is concerned. That is what is needed in a therapeutic art. Rather than giving more some explanations and theoretical knowledge. It's totally practical one. We have plenty of medicines, and Dr. Ajayan is definitely a wonderful personality as a professor in the Sharda Medical College, one of the premier institutions in India. So on behalf of IFPH, I'm expressing sincere thanks to Dr. Ajayan and all those who participated in the session, as well as Dr. Sanesh, who arranged all this program. Thank you.
Thank you, Dr. Manoj, Dr. Ajayan, and those who attended the session. Tomorrow, we will have a session from Dr. Vaidehi Bhatt, and she will be talking about unmasking the enemy, the insight into viral fevers. That is the second part of, so that is also a very important subject for tomorrow. It is really related to the summer complaint also. And I hope all of you will join tomorrow at the same time by using the same link. Definitely, we will have the second part of the same session from Professor T.A.J.AYAN in the coming month itself, as per sir's convenience. Thank you, sir. Once again. Please unmute, sir. Please unmute, sir.
Unmute.
Yes, thank you.
Okay, thank you, sir. Thank you, sir. Thanks.